Namaskar, my dear students. Today, in the quick review section, we will be discussing an important topic, that is principles of tooth preparation in a fixed partial denture. We will be covering the mechanical principles in this video. This topic is very important. It comes as a long question in the theory exam. Many viva questions are asked from this topic when we show our tooth preparation to the invigilator, and also number of MCQs are framed from this topic. So we will discuss them one by one. Let's begin. Principles of tooth preparation. The tooth preparation is a process in which we remove the enamel, dentine and the cementum to shape a tooth to receive a restoration. And the principles of tooth preparation can be divided into three broad categories. These are the biological principles, mechanical principles and the aesthetic principles. The biological principles which affect the health of the oral tissues, the mechanical principles which affect the integrity and durability of the restoration, and the aesthetic principles which affect the appearance of the patient. So in this video, we will be discussing the mechanical principles of tooth preparation. So coming to the mechanical principles of tooth preparation, in the mechanical principles, the first is to obtain the retention form of the restoration, second is to obtain the resistance form, and third is prevent deformation. The first form that has to be achieved mechanically while preparing is the retention form. Retention is defined as the quality of the preparation that prevents the restoration from becoming dislodged, from coming out, by any forces which are parallel to the path of withdrawal. So it should not come out. The retention form depends on mainly five factors that we will be discussing. First factor is the magnitude of the dislodging forces. Second is the geometry of the tooth preparation that we have done. Third is the roughness of the fitting surface of the casting. Fourth is the materials which are being cemented. And fifth is the film thickness of the luting agent that we have used. So let us discuss them one by one. So the first factor is the magnitude of the dislodging forces. What are dislodging forces? These are the forces that tend to remove a cemented restoration along its path of withdrawal. And the FPD or the crown is mainly challenged when these dislodging forces are applied, like the flossing under the connectors or when the patient is having a sticky food. The greatest removable forces generally arise when the sticky food or the caramel is eaten. This is one of the multiple choice question also. The magnitude of the sticky food, it depends on the surface area, the stickiness of the food that the patient is having, and the texture of the restoration which is being pulled. The second is the geometry of the preparation. Whenever we are doing the tooth preparation, the main golden rule is that we should obtain a single path of withdrawal. There should be a restrained movement, just like a nut and bolt. It is a sliding pair, two cylindrical surfaces, they are constrained to slide along one another. Because if any of the wall is over tapered, then the restoration will have multiple paths of withdrawals, and this will challenge the retention. Now let us learn more about this taper. So what is taper? Taper is the inclination or the relationship of one wall of the preparation to the long axis of that preparation. Now the second term which is important is the total occlusal convergence, that is TOC. It is the angle between the two opposing axial walls. Now if we talk about the retention, if the opposing walls are parallel, it will give us the maximum retention. Then the question is, why we give taper? What are the advantages of taper? First is to visualize the prepared walls. Second, to prevent any kind of undercuts, to prevent any kind of hindrance when we are seating the restoration. Third, to compensate the inaccuracy in fabrication. And fourth is that it permits more nearly complete seating of the restoration during the cementation. So these are the advantages of taper, which are often asked in the viva and also comes as a multiple choice question. Now next is again very important question, that is what is the ideal taper or the optimum taper, that is 6 degree. Okay. Second is the recommended taper or the clinical taper or the clinical goal, that is around 16 to 22 degree. Okay, the range in some books it is 12 to 22 degree. Okay, now if this is beyond 22 degree, then what? Then we give the auxiliary features like the grooves, boxes. We will be discussing them also. Now here I've provided you a table which shows the recommended taper for the specific teeth, okay, the maxillary and the mandibular along with the walls. Now coming to the first, if we talk about the maxillary interior teeth, mesiodistally and faciolingually, there should be a taper of 10 degree. Premolars 14 degree taper should be present. The overall taper is 14 degree. Molars, it is 17 mesiodistally and faciolingual 21 degrees. So the total convergence angle is around 19 degrees. Coming to the isthmus and the box, these are the intracornal features that we give. It should have a divergence angle of around 7 degrees. Mandibular teeth, interiors remains the same, that is 10 degree. Premolars 14 degree, just it is similar to the maxillary. In the molars it is 20 to 24 degree, which is 22 degree overall taper. Isthmus and boxes, it is around 12 degree of divergence angle. Now this table is important if you are solving the multiple choice questions. Now here in regarding the taper, there are certain key points which come as multiple choice questions. Okay, the first important point is that the posterior teeth, they are often prepared with greater TOC or the convergence angle than the interiors. We saw in the table also that the molars, they had the convergence angle of around 20 degree, while the interior they had around 10 to 14 degree. The mandibular teeth, they have more taper as compared to the maxillary teeth. Very important. The mandibular molars, they are prepared with the greatest TOC, that is the convergence angle or total occlusal convergence, which is around 22 degree. The FPD abutments, they are prepared more as compared to the individual crown. They have more taper because we have to manage the parallelism when we are doing the reduction for the bridge work. The next important point related to the geometry of the preparation is the surface area of the preparation. Provided the restoration, they have a limited path of withdrawal. More the surface area, more will be the retention. If we are maintaining all the norms, the longer wall preparation will always offer more retention. And the third point is that the molar crowns, they are more retentive as compared to the premolar because of the greater surface area. Now, next is the type of the preparation. Very important when we are talking about the geometry. Different types of preparation, they have different retentive values. When the other factors, they are kept constant, then a complete full veneer crown, it is the most retentive as compared to the partial coverage restorations. Okay, the second number, it comes the 7/8 crown with grooves, then comes the 3/4 crowns with grooves, 7/8 crown with no grooves, and 3/4 crown with no grooves. Okay, so this is the increasing order of the retention that they are providing. It is very important. It comes as a multiple choice question. The third factor in the retention is the roughness of the fitting surfaces of the casting. The roughening or the grooving of the restoration. This increases the retention to manifold. When the internal surface of the restoration is very smooth, the failure occurs at the cement restoration interface. And when we are doing the roughening of the casting by air abrading, okay, 50 micron of alumina is used, which increases the retention by 64%. Okay, and if we talk about the roughening of the tooth preparation, that is not at all recommended. The next factor, the fourth factor for retention is the materials which are being cemented. The retention is affected by both the casting alloys that we are using and the core or the build-up materials also. More reactive the alloy is, more adhesion it will give. Okay, with certain luting cements. The base metal alloys, they are better retained as compared to the low reactive gold alloys. Another multiple choice question. The next is the type and the thickness of the luting agent. Very important factor. The type of the cement is very important. If we look at this graph, the adhesive cements, the adhesive resins, they are the most retentive cements. Okay, next comes the glass ionomer cements, then comes the zinc phosphate and the polycarboxylate, and least is the zinc oxide eugenol, which is a temporary cement which is used. Now, if we talk about the film thickness of the luting agent, the effect on the retention is not still certain. The next is the resistance form that we'll be talking about. What is resistance? Resistance prevents the dislodgement of the restoration by the forces which are directed in an apical or oblique direction. Okay, and prevents any kind of movement of the restoration under the occlusal forces. Retention was towards the path of withdrawal, and resistance is under the occlusal forces. Resistance form mainly depends on three factors which are very important. The first is the magnitude and the direction of the dislodging forces. The second is the geometry of the preparation. And third is the physical properties of the luting agent that we are using to cement the restoration. The first factor which affects the resistance is the magnitude and the direction of the dislodging forces. If we talk about the normal forces, they are axially directed and they are easily taken by the restoration. But the mastication and the parafunctional activity, it leads to substantial horizontal or the oblique forces. The bruxers and the pipe smokers, they also result in the oblique forces. These lateral and the oblique forces, they tend to displace the restoration by causing the rotation around the gingival margin, and this challenges the resistance form. The second important point that affects the resistance form is the geometry of preparation. In this, we have five factors which are important, which affects the resistance form. First is the taper, that is the total occlusal convergence. Second is the occlusocervical height, the length or the height of the tooth preparation. Then comes the occlusocervical is to faciolingual dimension ratio. Okay, and fourth is the form of the preparation, the circumferential form, and last is the type of the preparation. So let us discuss them one by one. The first point is the taper or the total occlusal convergence that we have already discussed. If we talk in relation to the resistance, resistance is more sensitive than the retention when we talk about the taper. Okay, if the taper is 10 degree, it is difficult to place clinically. If it is 22 degree, it provides inadequate resistance. We will have to give the auxiliary features in this kind of taper. If it is 16 degree, that is the best convergence angle, which is the recommended, as we have already talked when we were discussing in the retention part. The second is the occlusocervical dimension, that is the height of the tooth preparation. The length of the preparation must be enough to interfere with the arc of casting, which is pivoting about a point on the margin on the opposite side of the restoration. As we can see in this picture also, this is the point of pivoting. This is the arc of rotation of this restoration. Okay, so this part which is above the this arc, it will provide the resistance form. So if the wall is shorter, we compare it with this. If the wall is shorter, it will not afford this resistance. Okay, and suppose if the wall is shorter, the preparation is small, then we should have little taper so that we get some of the resistance area. The proposed minimal height Okay, so that it gives us enough resistance form in the anterior and the premolar teeth. It should be 3 millimeter, and in the molars it should be at least 4 millimeter. Another multiple choice question. The next important point is the ratio of the occlusocervical, that is the height, to the faciolingual dimension. If we just see this picture, if we compare this picture in a smaller tooth, what happens? There is a short rotational radii. Okay, and this incisal portion which is marked with the arrow is the part which will resist the displacement. In a wider diameter tooth, that is in the molar, what happens? There is a gradual arc of displacement and there will be less resistance. So for every tooth, the ratio of the occlusocervical dimension, that is the length, to the faciolingual should be 0.4, that is 4:10 or higher, to provide a sufficient resistance form. The next important point is the form of preparation. Teeth should be prepared with certain amount of circumferential irregularity, or better to say that we should maintain its natural anatomy so that it provides the sufficient resistance form. The maxillary molars, they are prepared in a rhomboidal shape. The mandibular molars, they are rectangular. The premolar and the interiors, they are oval in shape. So it is important to preserve the corners of the teeth. Now here we are not talking about the sharp corners. The corners will obviously be rounded, but we have to maintain the shape of the teeth. Okay, so if there are no corners and we land up in a round morphological forms, then what to do? Then we will have to give the auxiliary retentive features like the axial grooves and boxes to give the resistance form. Now, if we talk about the auxiliary features, we mainly give the grooves and the proximal boxes. When we are preparing a crown, the dislodging forces, they are basically in the faciolingual direction. Okay, so the auxiliary grooves should be given on the proximal surfaces, proximal walls. And similarly, if we are doing the preparation for a bridge, then here the dislodging forces are mainly in the mesiodistal direction. So the auxiliary grooves, they are given in the facio or the lingual walls. Okay, we mainly give on the thickest walls when we are planning for giving the auxiliary features. Now these are very important multiple choice questions. Next is the type of the preparation. When we compare the complete coverage with the partial coverage crowns, the complete coverage crowns, they offer better resistance because in the partial coverage crowns, there is no buccal resistance areas. Okay, the axis of the rotation in the partial veneer crown, it is located at the linguogingival margin. Okay, another important multiple choice question. Okay, now in these cases we give the grooves or the boxes to increase the resistance. The proximal grooves of the partial veneer crown, it should provide the maximum resistance to rotation around this axis, that is around the linguogingival margin. Okay, the lingual walls of the groove, this is another multiple choice question. The lingual walls of the groove, they provide the resistance areas. They are perpendicular to the direction of the force, so they will provide the resistance form. The third important point for the resistance form is the physical properties of the luting agent that we are using. The resistance form is affected by the compressive strength and the modulus of elasticity of the cement. And the sequence, it just remains the same as we discussed in the retention form. The adhesive resin, they provide the maximum resistance. Then comes the glass ionomer, zinc phosphate, polycarboxylate, and zinc oxide eugenol being the least as the temporary cement used. Now in the mechanical principles, we have already discussed the retention form and the resistance form. The third important consideration is preventing deformation. A restoration must have sufficient strength to prevent this permanent deformation during the function. Let us see what are the factors which affect it. The three factors which affect the deformation are: first is the alloy selection, second is the adequate tooth reduction, and third is the margin design. If we talk about the alloy selection, the type 1 and the type 2 gold alloys, they are mainly used for the intracornal restorations like the inlays and the onlays. Type 3 and type 4 alloys, they are mainly used for the crown and the bridge work. The nickel chromium alloys, they are the most common alloys which are used for the crown and the bridge work. Second is the adequate tooth reduction. Adequate tooth reduction is very important to prevent any kind of deformation. Let us summarize the tooth reduction which is needed. For full metal restoration, 1.5 millimeter in the functional cusp area and 1 mm in the non-functional cusp area. The metal ceramic crowns, 1.5 to 2 mm in the functional cusp and 1 to 1.5 in the non-functional cusp area. For the all ceramic crowns, 2 millimeter overall reduction is needed. Okay, so the third point is the margin design. For the margin design, I have enclosed a video. In that you will find all the types of the margin, the supra, subgingival, their indications and all the designs of the finish line in detail. So that's all for this topic today. Just keep watching and stay tuned for the biological and the aesthetic principles which I will be discussing in the next videos. Do not forget to share and like the video. You can give your topics or your questions in the comment section. Wish you success today and always.